I want to start with a basic question. What exactly is CBTI?
Ah, I don't have a good answer to that. CBTI is so many things. Um,
Yeah.
I think that there isn't any one answer. The way that I explain it and the way that I sort of conceptualize it for myself, it is a semi-structured set of tools that we can use to help folks who are struggling with insomnia. And so when I say semi-structured, there's a couple of main things that I will use with most of my CBTI clients, but not necessarily, because sometimes they're appropriate for one person and not for another, and not necessarily in the same order. We'll start where it's appropriate for any particular individual based on how we conceptualize their case. And so then when I think of like the really big components of CBTI, I think of stimulus control, I think of time in bed restriction, and I think of the cognitive components, cognitive reframing, worry management and worry time, and then mindfulness and relaxation strategies as appropriate.
Okay. So that was four things. Let's quickly talk through each of them. Stimulus control. It's more than four. Yeah.
Well, no, you're right. It's four big categories, but it's funny to quantify it that way.
Okay. Yeah, so there's other pieces. Those are some main concepts. Briefly, what is stimulus control?
Stimulus control goes back to the idea that our brains are very good at recognizing patterns, and we can train ourselves, whether on purpose or accidentally, to associate certain things with certain other things. So the example I often give is, if I told you you were going to the movies, what food would you think of?
Popcorn.
Why?
Because I always get popcorn there.
Exactly. There's nothing actually inherent about movies and popcorn, except that, especially if you're in the US, probably any time in your life that you've gone to a movie theater, you have either smelled popcorn, tasted popcorn, heard popcorn popping, seen popcorn. So your brain thinks movies, popcorn, movies, popcorn, movies, popcorn. They are connected. In the same way, with healthy sleep, sleep and bed are connected. Because if you are somebody who doesn't struggle with insomnia, typically you go to bed, you sleep. So there's a daily pairing of bed, sleep, bed, sleep, bed, sleep. They become connected. With insomnia, that connection breaks. The bed becomes associated with all sorts of things that are not compatible with sleep. Things like anxiety, frustration, struggle, that sense of laying in bed and just, I want to sleep, but I can't. And so stimulus control is a way to help unbreak, or rather, unlearn the association between bed and frustration and relearn the association between bed and sleep.
Got it. Okay. And what about bed restriction?
So time in bed restriction is designed to help drive out shallow sleep or awakenings in the middle of the night. The analogy I often use with clients is, if you imagine your sleep drive to be like a ball of dough, and you roll out the dough to a certain point, and at some point that ball of dough becomes a pizza or whatever it is you're making. And now imagine rolling out that dough past that point. What happens to that dough?
It just gets very thin. Very
Exactly.
flimsy.
It gets very thin. It might develop holes and lose some structural integrity. That's what can happen to your sleep drive if you spend a lot of time in bed. Mm-hmm. And guess what folks with insomnia tend to do? They tend to spend a lot of time in bed as a response to not sleeping enough. This is a perfectly reasonable on the surface impulse. I'm not sleeping enough, let me spend more time in bed to try to sleep more. Except that what happens is the sleep drive gets stretched very thin, and folks develop middle of the night awakenings. They develop like bouts of more shallow sleep that is lower quality. And so what we want to do is we want to compress that back in. We want to get the pizza dough to be the shape that it should be rather than this giant thin thing. And time in bed restriction puts people on a set schedule, a set amount of time in bed. Usually we do this by looking at the average of how much they've been sleeping and adding about 30 minutes to it, but there's some case-by-case considerations. And then once their sleep is consolidated and they're getting better quality sleep and they're sleeping through that chunk, then we start gradually expanding them back out to a place that is more comfortable and is more a better amount of sleep for them.
And I bet that actually also helps with the stimulus control aspect as well.
Yeah. If you are on a schedule where you're spending a lot less time in bed, well, there's a lot less time where you're going to be lying frustrated in bed, but you're not going to be in bed so much.
Exactly. Okay. So the next piece you talked about was the cognitive aspects of CBT-I. What does that involve?
Yeah, so that's kind of a big umbrella for a number of things that we might do. One big one is identifying what beliefs people are holding about sleep and identifying which of those beliefs might be accurate and which of those beliefs might be inaccurate or unhelpful. So, for example, a lot of folks come to me with a belief that they need 8 hours of sleep to function. And then we look at what their life has looked like, with their insomnia, and chances are very good they're not getting 8 hours of sleep. And they're functioning. They might not be functioning at their best, and they might not be happy with how they're functioning. But to say, I need 8 hours of sleep to function, is both inaccurate and unhelpful, because it puts a ton of pressure. They are putting a ton of pressure on themselves in their sleep, which then paradoxically makes the sleep worse. So we look at what beliefs might be doing that, might be putting undue pressure on their sleep, might be adding emotional suffering on top of the pain of not sleeping enough, because it is certainly painful. And we work to reframe those and to provide context for those as appropriate. So that's one big piece. Another piece is anxiety and insomnia go hand in hand very often. And so for a lot of folks, one of the things that happens when they're struggling to fall asleep is they are getting just spirals of worry. Worry about day-to-day stuff, worry about future stuff, worry about sleep, just those spiraling thoughts. And often during the day, they might get those thoughts if they sat quietly, but they don't allow themselves to do that. They're busy, they're living their lives, they're doing whatever they're doing, and that's keeping the thoughts away. But then at night, when there's nothing to occupy them with, those thoughts come out. And so one of the interventions we use is something called worry time. It is specifically scheduled time to worry, to sit down and engage with the thoughts that might be popping up at night at a time that is not the night and at a place that is not the bed. And worry time is actually, in many ways, similar to stimulus control. It is a way of training yourself that, like, oh, this is a time and a place for these thoughts to come out. And it's also space for those thoughts to come out. And the client can decide at that point, do I want to make particular plans to handle these issues? Or maybe I just want to sit with them and let them percolate because they're not really solvable. But by giving them space, they're less likely to then come bother me in the middle of the night in bed.
Makes a lot of sense. You can't get rid of the worries. You can only deal with them productively.
Exactly.
Okay. And then what about that last piece you mentioned, which is the mindfulness aspect?
Yeah. So I think of mindfulness and relaxation, which are two separate things but can be related in some ways, as things that we can incorporate as part of reducing anxiety, as part of a wind down routine. In the case of mindfulness, it's something that can also help you train your attention. So, for example, around the worry time kinds of things, of learning how to pay attention to what you want to pay attention to, for example, your breath or an activity that you're doing, rather than paying attention to the spiral of thoughts in your head. I very explicitly talk to folks that neither mindfulness nor relaxation exercises are meant to be something that puts you to sleep. They might as a side effect, but that's not the goal. And if we make it a goal, it actually becomes counterproductive because then we're putting pressure on a thing to make us fall asleep, which is not what I want to do at any point. And so what I will recommend is, again, with mindfulness, I actually recommend that folks do that either in the morning or afternoon, because the goal with mindfulness really isn't to fall asleep. The goal with mindfulness is to train your attention. You can't pay attention to something if you're asleep. With relaxation exercises, I usually recommend that folks do that as part of their wind down period before bed. Again, as a way of just bringing down those levels of anxiety. And those can be any number of strategies. People sometimes prefer more physical relaxation strategies like progressive muscle relaxation. Other people prefer more mental strategies like visualization or, other forms of meditation that might not be mindfulness as such, but maybe following some sort of meditation story or things like that. It's a very individual decision, so I don't have a particular suggestion for this is what's right for anybody, because there's no such thing. But just as part of becoming ready for sleep.
Yeah, that's really interesting. So practicing mindfulness is actually, or meditating for that matter, is not actually just trying to relax and fall asleep. It's something else that's quite different.
Yeah, obviously different people will mean different things when they say meditation or mindfulness, but the way it's always been taught to me and the way I conceptualize it is that mindfulness is really a way of training attention. That's the underlying piece of it. And so that I want to do when I'm a little more alert.
Yeah. Yeah, mindfulness is a skill of training attention, not a way to just knock you out.
Right. And it might feel relaxing, or it might not.
Yeah. It's really interesting because I think most people do use meditation or meditation apps as a way to fall asleep. I think I talked to someone a while back about user data at, meditation apps, and they noticed people primarily use them at night right before bed. That is the major spike.
Yeah, and certainly they can be helpful for quieting your mind. And if you're somebody who finds that helpful, I don't think there's anything wrong with that. But I'm careful to make the distinction between like meditation and relaxation, etc., versus specifically that mindfulness component of awareness and attention.
So just because you've listened to some meditations on an app before bed doesn't mean that you necessarily know all there is to know about mindfulness yet.
Yep.